All right. So another category of disabilities in children involves sensory disorders. And this can include, for example, visual impairments and a couple of terms that you might see related to visual impairments in educational settings are low vision and educationally blind. So low vision is when a child's vision is rated as between 2070 and 2200. And what that means is this. When you hear 20/20 vision, that means that I can see at 20 feet what a typically seeing person can see at 20 feet. So 20/70 means what I see at 20 feet is comparable to what a typically seeing person sees at 70 feet. And 2200 means what I see at 20 feet is typical a typical person sees at 200 feet. So you can see that's really struggling to make out visual information at that level. And educationally blind means it's that level of past 2200 where really we're unable to use our vision in learning. And so we'll have to use sound or tactile information. The most common visual impairment is called myopia, which is nearsightedness. A less common one is hyperopia, which is farsightedness. And another term you may hear is strabismus, which means the eyes are not properly aligned with each other. Uh, Children who are born early, who are born preterm, are the children who are most at risk for visual problems. Another type of sensory disorder is hearing impairments. There is some hearing loss in about 15% of children. For children who are unable to use hearing in educational settings, there is debate that continues among experts. And uh, I'm not a person who can, I do not have a hearing impairment. And so I can't really speak to this debate. But it's something like this. There's one group who favors what are called oral approaches, which involves lip reading, speech reading, and capitalizing on any residual hearing that the child has. So even when a child is described as deaf, they typically have some residual hearing. They can hear certain pitches or certain tones of sound. On the other hand, there are those who advocate what are called manual approaches, and those are approaches that uh, predominantly focus on sign language, physical spelling. And within the deaf community, there's a great deal of debate about which of those is preferable, and you should just be aware that those two approaches exist. All right, there's another wall of words, and I won't read all of this, but understand that there is a condition that's called sensory processing disorder and sometimes called sensory integration disorder. People will use those terms basically interchangeably. What happens here is when the messages from our senses arrive at our brain, the, our cognitive response uh, overwhelms us. We're not able to process that sensory information in a way that we can handle, that we can cope with. So it could be taste, it could be movement, it could be the feel of fabric, it could be a number of things. Uh, so when those sensory signals get to the brain kind of has a hard time processing that information, and that results in feelings of anxiety, or maybe a child acting out, or maybe a child feeling like a failure and becoming depressed. So this is another condition that can look a lot like autism, but it's really coming from a sort of a different place, and it involves the ability to integrate that sensory information. Children on the autism spectrum can also share a common set of behaviors. They can also have difficulty with processing sensory information. Another category is physical disorders. These are physical uh, situations that can impact a child's ability to uh, adapt at school or to perform educationally. One major category here are orthopedic impairments. These are conditions where there are difficulties in movement, where because of uh, the muscle, the bone, joint problems make it difficult for a child to move. Another condition that falls here is called cerebral palsy. Cerebral palsy is a result of a lack of oxygen either immediately before, during, or immediately after birth. So during birth, the child may not be receiving enough oxygen, for example, because the umbilical cord may be pressed against their body or against the birth canal or maybe somehow caught off. And so that lack of oxygen can have a lifelong impairment on the child's motor skills, but not in their cognitive functioning. And so it's a motor condition. Cerebral palsy, there's a lack of muscular coordination. There can be shaking. Uh, it can be difficult to produce speech because of the control of the muscles that are necessary for producing speech. The most common type, and I want you to understand this is a medical term, is called spastic. And spastic is a word that has been kind of misused, uh, kind of as a slur. And so we have to be really careful in how we think about that word. Spastic occurs when a child with cerebral palsy has sort of a shake that's uncontrollable. And I need you to understand too, there's a range of impact of cerebral palsy. It can be more or less severe depending on the amount of anoxia or that lack of oxygen that occurred before and during birth. Another broad category are emotional disorders. And emotional disorders are diagnosed when there are persistent problems, not isolated, but not short term, but ongoing serious problems with things like establishing and maintaining relationships with others, or aggressive behavior, depression, phobias, or school related fears. Any social emotional issue that uh, makes it difficult for a child to do the things that they should be doing at school, and makes it difficult for them to learn, would be classified under this emotional disorders group. And here's a big word wall, and this will probably be about as far as we get today. Because one thing that falls here are childhood anxiety disorders. And there are a number of different types of, of anxiety disorders. One is what's called a generalized anxiety disorder, where children have difficulty with excessive worry. They'll worry about things, and so that can impact their behavior. Uh, and it's a called generalized because it's not worry about a specific thing. Panic disorder occurs when is diagnosed when a child has at least two panic or anxiety attacks, and then they have at least a month of being worried about having another. Another anxiety disorder is called post-traumatic stress disorder after some traumatic event, such as a hurricane or a storm or the forest fires destroying a home. There's this intense fear and anxiety that's difficult for the child to move on from, and it can arise and interfere with the child's ability to do the things that they're trying to do. Social anxiety disorder is sometimes called a social phobia. It means that there's an intense fear of social interaction. This is not shyness. This is a really intense fear of interacting with others. Another um, condition that can be included under childhood anxiety disorders, and it can also be classified as a language disorder, is called selective mutism, which means a child has the physical ability to speak, but they refuse to do so. There are any number of specific phobias, which is this intense, irrational fear of some specific thing. It can be school phobia, it could be agoraphobia, which is fear of leaving home. These impact the child's ability. They're so severe that they impact a child's ability to learn. PANDAS is pediatric autoimmune neurological disorder associated with strep. And what happens in PANDAS is a sudden change, abrupt change in a child's behavior that's brought on um, by a strep infection. So, strep is a virus like many others, and it wants to survive and do its thing. And sometimes strep can sort of hide from a child's immune response by mimicking uh, parts of what is called the basal ganglia, which is a part of the child's brain. So the strep kind of hides there. And the child's immune system then starts to see that part of the brain as the strep infection. And so it's an autoimmune disorder, which means that their immune system is attacking themselves. And what can happen if that occurs is a really rapid change in a child's behavior. So a child who has not shown any uh, obsessive compulsive kinds of behavior before can have suddenly have severe panic, severe obsessive compulsive behavior. It's very common for children with with pandas to think that their food is poisoned or that it has needles in it and they'll refuse to eat. Really irrational fears, really psychotic level fears and oppositional kinds of behavior. Um, and I'm going to wait to talk about autism until our next